Good evening, everyone. Welcome to the third session of Let's Talk Health, a specially curated Facebook Live session wherein we get all the specialty experts to one platform, discussing and addressing all your health concerns. So today we are going to talk about laser surgery as a treatment option for kidney stone removals. And for that, we have Dr. Bhanu Teja Reddy, consultant urologist with us. Welcome to the show, sir. We would like to, kind of understand about a little bit more about yourself so that the viewers understand what are your specialties, and then we can continue with the questions.
Yeah, sure. Good evening, everyone. I am Dr. Bhanu Teja Reddy, consultant urologist and microsurgical andrologist, presently working at Citizens Hospital and American Oncology Institute. So I am specialized into laser surgeries for kidney stones, ureteric stones, and bladder stones. Along with this, I also do laser surgeries for prostate and stricture urethra treatment. Along with this, I have been specialized into entire andrology treatment gamut, which includes male infertility management as well as microsurgical procedures related to male infertility and sexual dysfunction.
Okay. So we will start with the first question. And to start off with, I would really like to understand what are kidney stones and how is it different from gallbladder stones?
Okay. So kidney stones and gallbladder stones are completely different. Even the process of formation is completely different. So kidney stones are most commonly occurring stones, usually which we see in our urinary system. So they can occur in the kidneys, they can occur in the ureters or in the bladders. So kidney stones usually form by crystallization of some minerals like calcium, urate or cysteine. Whereas gallbladder stones are like pebble-like stones which are seen in the gallbladder. They usually form because of accumulation of some cholesterol or pigment-like material.
Okay. So how does one actually prevent from getting kidney stones?
So prevention of kidney stones is mainly by some lifestyle changes, like you should be well hydrated, have around 3 to 4 liters of water every day, having less of red meat, having good balanced diet with fruit and vegetables, and low sugar and carb diet. That's how you can maintain your dietary habits and balance yourself from preventing the formation of kidney stones.
So, what are the treatment options that are available for kidney stones removal?
So now we have the most advanced laser treatment for kidney stones, but before that we used to do surgeries with a small hole in the kidney, creating a small hole into the kidney and then breaking the stones and removal. So with the laser coming in, with the newer technology advancements coming in urology, so now we clear the stones entirely endoscopically. So we pass in a small 2 to 3 mm scope into the kidney through the normal urine passage without creating any holes externally. And then with the help of laser, we completely powder the stone and then clear it off. So this is the latest advancement which we have now.
Okay. And could you help us understand a little bit more about laser surgery?
Yeah, sure. So laser surgeries, so there are two types of lasers which are used for kidney stone breakage in urology. One is holmium laser and one is thulium laser. So both are good enough, but the thulium laser is the latest one into the market. And the advantages with thulium laser are it causes fragmentation of stones more faster, and it makes fine dust of the stones. So in laser kidney stone surgery, so as I have told you, the 2 mm scope is passed through the urine passage in a reverse fashion. Normally the urine comes from kidneys to the bladder and comes out. So we go in through the bladder into the kidneys in a reverse fashion with a 2 mm scope, and then see the stones and completely powder the stones and remove them off.
Okay, so who do you suggest are the best candidates for getting a laser surgery done?
So in the present days, everyone can get a laser surgery done. So we usually decide whether to go for a laser surgery depending on the stone size, the location of the stone. So usually with the previous lasers, the stones of around 1 to 1.5 centimeter would be done through lasers. But nowadays with the advanced thulium laser which we have here today, we can even clear off stones until 2 to 2.5 centimeters without any issues.
And what are the advantages of laser surgery?
So the main advantages of laser surgery include there is very, very minimal pain. So hardly any pain to the patient, and there is no bleeding or no blood in the urine even after the procedure. And the patient can just walk immediately 4 to 5 hours after the procedure, and he goes home then very next day. So he's back with his daily routine activities from the next day onwards. So there is no hole into the kidney or damage to any kidney tissue with the laser surgery, as well as the other modalities like PCNL, percutaneous nephrolithotomy, which we used to do earlier. So that had a damage to the kidney tissue. With the laser treatment, there is hardly any damage to the kidney tissue as well.
And are there any complications because of the laser surgery?
So the complications are almost less than 2%. The most common complication which we usually see is some kidney infection which develops after this procedure, because usually we do the procedure, kidney is a closed system. So there is a chance that less than 2% of them developing some kidney infection post-procedure. So other than that, there are no other complications which are associated with this laser procedure.
Okay. And what do you suggest are the follow-up care that one should have after the laser surgery is done?
Yeah, so follow-up care is the utmost importance in kidney stones, because we usually see patients coming up with the recurrence of stones. So usually more than 50% of them tend to develop kidney stones in 10 years period. So we here as a protocol, we send a piece of stone for analysis. So what this does is we'll know what type of stone the patient is forming. So when we know the type of stone, we can adjust his dietary habits based on that. So there would be prevention of further formation of stones, as well as we can give some medications. If it's calcium stone, we can give some medications for a little long term, for around a year or so that he will reduce formation of such type of stones further.
Okay. And how long does it take to recover?
Yeah, so it's usually we do the procedure the day we admit the patient, on the day of the procedure, and we discharge him the very next day. So once he goes back to home, he is back to all his daily routine activities, as well as he can go back to his work as well. So it's just 1 day of hospitalization which is required. After that, he's all good to go.
Okay, great. So does the kidney stone reoccur after the surgery is done?
Yeah, so there is a chance of recurrence. So the recurrence usually happens in 50% of them. Over a period of 10 years down the line, they tend to form stones again. So once a stone former is most likely a stone former. So that is why we give the proper advice for his prevention and dietary regulation of habits.
And how do you see that? How safe is this laser surgery?
So it is quite safe, because earlier there were all bigger scopes which we were using. Now with the miniaturization of the scopes, so there is hardly any difficulty in passing the scope, and usually the stones get completely powdered, so they don't tend to have much of a pain. So there is not much of a bleeding which occurs during the procedure. So there is no damage to any kidney tissue. So it's quite safe nowadays for the laser surgery.
Okay, great. Great. I think we really had an informative and really insightful conversation about kidney stones and the laser surgery both. And with this, we will wrap the show right now. But do please send us your questions in case you have some queries. Leave it in the comment section below, and we will get back to you. Please stay tuned for more such informative sessions every Friday at 4 p.m. Thank you.
Thank you.